Hey guys, back again with some thoughts and review of a couple studies. Before I jump into this, I wanted to touch on what we covered up till now, or at least for the past couple weeks, if you've been following this at all. Talked about how if chiropractic is the first visit to a doctor for issues like spine pain, neuromusculoskeletal issues, your chances of ending up in surgery are dramatically different. That's well documented. And if we're the first visit for that category of neuromusculoskeletal issues, you're also far less likely to be prescribed or end up somewhere where you're going to be prescribed narcotic type painkillers, opioids. And so those are two tremendous helps. So the big picture there is, of course, if chiropractor is the first visit, you're going to have a much greater chance to decrease more invasive interventions. So, flowing from that, in this day of high deductibles, high costs, high healthcare costs, and premiums, keeping costs down is also huge. Personally, for folks and for the big companies out there. So another part of cost is missed time from work. So a lot weighs in on exactly what goes into cost of back pain, but we know that it's a very common problem for workers, for just the general population. So a lot of money is spent on fixing those issues. So I had a couple quick surveys to look at. One's called Cost of Care for Common Back Pain Conditions, initiated with chiropractic. This is doctors versus medical doctors or osteopaths as first physician. This was from 2010. This looked at over 600,000 people. Okay, it's based on a Tennessee general health insurer. So, well done study. It says that they examined the effect of initiating care for low back pain with medical doctors or with a DC, Doctor of Chiropractic, in a system that has removed the traditional constraints that are imposed by insurance companies. Had some interesting results. As an aside, surveys showed that patients were highly satisfied with chiropractic care. It also has found statistically significant lower costs in episodes of care initiated with a DC as compared to an MD. And our results, their quote is saying, our results support a growing body of evidence that chiropractic treatment of low back pain is less expensive than traditional medical care. So this matters for you because with high deductibles, we're paying those costs. It's not just co-pays anymore. So the beneficiaries in the sampling frame had lower overall episode costs for treatment of low back pain if they initiated with the DC. So this is good news when we're paying for things out of pocket. And another one, systematic review comparing costs of chiropractic care to other interventions for spine pain. This had a lot of interesting statistics for me, at least, but it notes, and this is not unheard of. Spine pain is one of the most common and costly causes of healthcare utilization in the United States. It said that only 3% of visits to medical physicians are related to spine pain, which I thought was amazing. Chiropractors, because we do see far more spine issues, they said were more confident in their ability to manage spine pain than medical physicians. That's not a knock against them, but of course if they see it less, how could they be more confident? He said patients with spine pain report higher levels of satisfaction with chiropractic care than care from a medical physician. There's a lot of things that go into that, but of course, good job, chiropractors. The authors note that it's important to understand that indirect costs account for the majority of the total cost of spine pain. That would be what I was mentioning about missing work. And that even those were generally lower from folks going with chiropractic care. So in general, the findings in this review suggest that healthcare costs may be lower when the spine is managed with chiropractic care. And whole rationale being is, since chiropractors aren't covering up pain with medications, which is usually the first course, hopefully folks are actually healing, and hopefully you are going to be healthier when you leave. So as you're considering going to a chiropractor or referring somebody to a chiropractor, if there's any financial objections, just keep in mind that there's good reason to think, even in this day of deductibles and higher costs, that the visits to our offices are going to, number one, heal you, help you function better, but number two, cost less. Y'all take care.